Today, let's talk about polysomnography, a crucial study that can determine if you have sleep apnea and its severity. Polysomnography is like a high-tech sleep study, monitoring brain waves, oxygen levels, heart rate, breathing, and even leg movements while you sleep. This test comes in two forms: the traditional in-lab version, where you spend the night at a sleep center with all the necessary equipment and specialists, and the convenient home-based version, where you can conduct the test in your own bed using a portable device. Now, for a deeper dive into this intriguing topic, here is Dr. Roger Sehult from MedCram. His YouTube videos break down everything you need to know about polysomnograms in a way that's both informative and easy to understand.
What exactly is going on in sleep apnea? Let's take a closer look here. This is known as a polysomnography. We look at the brain waves and we can tell when they're sleeping. This person is sleeping because we can see this in the brain waves. You may not be able to recognize this, but the brain waves are slow enough that they are sleeping. We're looking here at different parts of the brain. We're looking at their eye movements. We're looking at their muscles. We're also looking at what their heart is doing. We can see the heart rate going across here, and you can see their heart rate 62, pretty consistent. And then the key is looking at their oxygen saturation. You can see here, this point right here, their oxygen saturation is close to 100%, but then it drops down, and then it goes back up again, and then it drops down. Why is that happening? Why is there this undulation of oxygenation? Well, it's because we're looking at flow through the nose, and then basically it stops. There's no flow happening at this point here at night. And when we look at their chest movement starts to go down, but it's not completely stopped. We see their abdominal movement's not completely stopped. It's as if they're trying to get air in, but no air is going in. This is basically a very diagnostic pattern for obstructive sleep apnea. The muscles are trying to get the air down, but because the airway is closed off where we showed you, you're not going to see any movement of air, and air is actually not getting in. Then we see the leg movements here pretty consistently not moving. Basically, no airflow is happening, and that causes the oxygen saturation to drop. Until, of course, it drops so low that there is an arousal in the brain, and that causes the airway to open up. We start to see the motion again with the abdomen and the chest, and then, of course, we start to see airflow again until the oxygen level starts to come back up. When it comes back up again, things are already starting to shut down, and we see this cycle over and over again until finally it gets so bad that there is a huge arousal. The patient wakes up, and now we are awake. And that's the problem. And we see this happening over and over. Sometimes this can happen up to 100 times in an hour. That means at least once a minute or more, maybe even twice a minute that this is happening. You can expect that people are not going to get very good sleep with this. This is what it would look like the entire night compressed. Let's take a look at everything here before the purple line. What we're looking at here is a lot of different things. We can see oxygen saturation. It's not straight. It's a jagged line, kind of Richter scale-ish type of look, and that's because the oxygen's going up and down. The heart rate is also going through a workout during the night, going up and down. Each one of these bars right here is where the patient almost completely stops breathing, and you can see that when they almost completely stop breathing, that's coordinating here with decreased oxygenation. So this is a real problem when people have sleep apnea and they're not getting appropriate oxygen at night, they're not getting appropriate rest at night. There's other things that happen when all of these things occur and the oxygen levels go down. This is going to excite the brain and the sympathetic nervous system, and blood pressure is going to go up. And all of these things that are cardiovascular endpoints that we look at in studies are going to go up. In the general population, when do people generally die? So we're looking at these bars right here. If we were to divide the day into 25%, so we have midnight to 6 in the morning, 6 in the morning to noon, noon to 6 in the evening, and the evening till midnight. When do people generally die? Well, people generally die between 6 o'clock in the morning and noon. And why is that? Well, there's some theories that maybe it has to do with cortisol. Cortisol levels are the highest at that time. Blood pressures are up. People are getting up from bed. That's when typically we start to see all-cause mortality at its highest, although it's pretty even. What about people with sleep apnea? Notice when we're looking here at sleep apnea, we're looking at these bars here. And you can see that people with sleep apnea, the most likely time for them to die is between midnight and 6 o'clock in the morning. And you can imagine why that would be. They're going through the gauntlet at night. They are trying to breathe. They're not. Their oxygen levels are low in the 60s or 70s. Their blood pressure is high, even during the day. If we look at sympathetic nerve activity during the day, when they're awake, when they're not having sleep apnea, in a normal person, this is what their sympathetic nervous system activity looks like. In people with sleep apnea who are having these difficulties at night, This is what their sympathetic nervous system looks like during the day when they're actually not having apnea. It's because it's ramped up. And this is a problem. It causes their blood pressure to not be able to relax and get that rest that it needs when you have sleep apnea. This is something that is called dipping and non-dipping. People who have no apnea, in the blue, notice what happens. Their blood pressures go down at night, here in the 3 a.m. to 6 a.m., goes down at night. They're systolic and diastolic. But the people who have apnea, they don't get the benefit of that dipping. They're not getting the benefit of rest at night. It's because of sympathetic nervous system activity. So you can see here that this mechanical problem can cause quite a bit of issues. We can talk about the diagnostic criteria and how to test for that. These are things that healthcare providers need to know how to do. Your job as a layman is to understand that you may have this condition and to present to your healthcare provider for further testing.
Thank you, Dr. Seholt, for that insightful explanation. If you suspect you have sleep apnea, please consult your healthcare specialist and get a polysomnography test. This will help determine if you have sleep apnea and enable you to take control of your health.